Doctors, therapist have read it. Do you have any? No. That's not normal stories. Not a doctor, but I had an experience like this with someone I slept with. We had just finished and were cuddling when he remarked that he was happy. He felt like he was in his body. I looked at him funny and asked him what he meant, and he said, you know, that funny feeling you get after sex where you feel like you're not in your body. You're like looking at yourself from the opposite side of the room. Well, right now I don't feel like that. I feel happy instead. I tried my best to not look horrified, and I asked him if it was always like that for him. He explained to me that it only started happening after something awful happened to him 2 years ago. I had to do my best to gently explain that no, I do not get that funny feeling, and most people don't. I also had to explain, to the best of non-professional capacity, what disassociation was. Guy in his 20s came in complaining of belly button problem. I examined him. He had an irritated scab inside the belly button caused by aggressive lint picking. But dude was sweaty and had a slight tremor. Looked like crap. When I asked how he was feeling overall, he said, oh okay, I guess. Just a little tired. Drank a little more this week than usual. Probably overdid it. I had to pry for details, and turns out he drank a gallon of gin over the last 3 days and stopped drinking alcohol when he started vomiting large amounts of blood and pooping a mixture of bright red blood and dark sticky stuff, melina digested blood. He was totally unaware of the fact that he was going through alcohol withdrawal, sweating, shaking because he hadn't stopped drinking long enough in recent memory to experience symptoms. I sent him straight to the emergency room, where they found a tear in his esophagus that required immediate intervention, and he was admitted for inpatient alcohol detox. I read his hospital note. He still insisted that the ed doc examine his belly button. 50-ish-year-old man who came in for chronic issue follow-up. He brought his wife with him this time around. At the end of the visit, she says, hey, tell the doc about that thing you can do. He turns to me proudly and tells me that he can whistle from his dung. If he really pushed, he could blow gas from it. His wife insisted it wasn't normal, but he was certain most guys could. Turns out, he had a connection between his bowel and his bladder. Mom brings her kid in because the babysitter was concerned about these spells the child would have. Apparently, the child would have episodes where he would just blankly stare at them and not acknowledge whatever it is they were telling him, or whatever he was doing. The parents just thought he was being an asshole and not listening to them, or being absent-minded. Kid turned out to be having absence seizures. A younger gal who had come in for generalized abdominal pain that she experienced on and off for years, but just always wrote off to either menstrual cramps or bad food or life. We had asked her if her bowel movements were regular, and she said yes. At some point, someone was sharp enough to ask her how often she had bowel movements, to which she said about once every 2-3 weeks. She had been suffering from pretty severe constipation, but just thought it was normal to have BMs once to twice a month. I'm sure I have more, but I think I wrote enough for now. I was a patient, but when I went in for a routine physical, the doctor poked my extended belly and asked how long it had been like that. I laughed and said, what? My beer belly? Oh, since I was 21 probably. Turned out that, no, the beer belly was a cyst that had grown really large, and that was why my friends kept saying I looked pregnant. I thought I just had really shitty friends. Had to have emergency surgery, and for a week or so they did not know if it was a cyst or ovarian cancer. It was a pretty big scare. The lady with type B COPD who had long-term cigarette user symptoms. She spontaneously got COPD, having never smoked in her entire life. A pimple on her breast that was actually a 4-inch wide, bleeding and necrotic breast tumor protruding through her skin. I was a patient. I had no idea that it wasn't normal to uncontrollably sob for 2 weeks out of every month, have breasts so sore I couldn't go downstairs chiggle, and then have it all stop the day you start your period. It took me getting a female roommate at 30 for me to realize that wasn't typical. I asked my obgyn, after charting my symptoms for 6 months, PMDD, a depressive disorder that is tied to your menstruation, a change in birth control pills fixed it right up. He also looked at me like I was crazy for thinking that was normal for 16 years. I asked my mom after my diagnosis. Oh yeah, remember in high school, your friends would come over and ask if you were crazy that day or not? No mom, they didn't ask me that. Thanks for letting me know. I feel like my story belongs here, even though I'm the patient, since the exact scenario happened to me. A few years back my mental health totally took a skydive. As a result I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So one day she'd ask about relationships and the next, childhood memories and so on. After a few conversations she focused on my social life. I then told her that it's pretty much non-existent. And it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with the two voices in your head always keeping conversation. But surely she knew that, right? Well, as it turns out, no. Apparently everybody else only have their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. Who TF knew A? Obligatory, I'm the patient. I thought for years that I was just continually getting more and more out of shape. Despite my best efforts, nothing helped. I would just hit this wall and couldn't keep going. Eventually I couldn't walk from my driveway to my house without needing a break to breathe. Turns out shortness of breath isn't just something to wave away, it's also something I wish doctors had taken seriously. In the span of 2 weeks, I went from seeing a local clinic PA to being admitted to the ICU. My doctor told my husband he had no idea how I was still alive, nevertheless functioning. Was on urology rotation in medical school when a 20-something-year-old male presented with the complaint that one of his nuts was too small and he wanted them to be equal because it was embarrassing. One testicle was normal, the too small one, while the other was the size of a grapefruit. Unfortunately the cancer had metastasized. Not sure how he did long term as I rotated off the service after he had surgery. As a patient, I went in for a standard sleep study because I was always exhausted. Doctor asked me afterwards if I would consider signing a release for him to write a paper on me. Apparently I moved my legs over 9,000 in the course of the night. Apparently it was RLS. I wasn't realizing I had. My wife never even told me I did it, and I had no idea. She casually agreed after I told her what the doc said. I barely met the recs for moderate sleep apnea where they will recipe a machine. God, I love that thing. I sleep so much better with it. Wiffy on the other hand, uses hers and sleeps with her mouth open. So annoying to listen to the air hiss out all night. I had a root canal needed in a molar. I went in so he could prep it for the next step, but 2 hours in, and he had to call it for the day. So by the 4th 2-hour visit, when it was finally done, I was sick of seeing my dentist. Almost a year later I'm back at the dentist, and he turns to his assistant and says, "This is the one with that root canal." I'm a legend, apparently. Not a doctor, but when I was maybe 14 or 13 I remember describing to my primary how during my periods I would pass out from the pain, couldn't move or I would get sick, and told her a story about how I went on a trip to Italy and sometime in the middle of the flight became wildly sick to the point of terrifying the poor flight attendants. I'm so sorry, flight attendants, by filling 4 puke bags, crawling to the back of the plane clutching my stomach, finding the doors locked, attempting to use the first class bathrooms so I could finish being sick. When denied entry, just lay down in the aisle waiting for sweet death to take me. It did not. Death has terrible customer service and then passed out when we exited the plane. But periods are supposed to be painful, right? The doctor was like, "Honey, you're supposed to experience some discomfort not being capacitated anyway." She put me on birth control and I've never been happier. This happened to me. I woke up with a period so heavy the bed was soaked. Stood up and it just poured out of me. clots the size of my palm. Overwhelmed, I did what any woman would do if they could and phoned my mum to come over and comfort me and help me clean up the mess. At this point I was still thinking, this is a strangely heavy period, and I was more worried about how my landlord would react to the carpet. I then fainted, woke up, fainted again, phoned mum to cry about my stupid period making me miss work. My parents called an ambulance that arrived to the house first and rushed me to hospital. Not period. Massive internal hemorrhage in the womb. Consider subscribing if you enjoyed this video, and if you want to see more of Reddit Universe.